Today, I am thrilled to welcome Dr. Jenny Tufenkian. She's a naturopathic doctor, so bringing some views that are probably diverse from mine. She's been focused in this field for the last 20 years. And what I really love about her approach is she combines trying to heal the physical body, the mental and emotional body, and even the energy body. And I'm looking forward to hearing more about that.
Right. Yeah, you can probably appreciate this. I talk about my patients can talk about tire like wine connoisseurs talk
Right.
about fine wine. And I had one of my patients said, "Oh, sommelier of tired." I said, "Yes,
I
sommelier of
love it.
tired." Because there isn't just the one kind of tired. So I let me go through the five root causes
Mhm.
and then I'll kind of talk about what they may feel like in a body.
Welcome to the Dr. Eleanor Stein podcast. In this show, you will hear expert medical professionals, researchers, and people with lived experience share science-based, low to no cost strategies to help people with complex chronic diseases. Listen in for another dose of education, empowerment, and hope. Hi, everybody. I am Dr. Eleanor Stein, welcoming you to the brand new Dr. Eleanor Stein podcast. On this platform, I'm going to bring together people with very diverse views and a lot of practical tips to help you heal from complex chronic disease. It's an area that I know a lot about, having lived through it for about 35 years, and I have the same amount of time of clinical experience. Today, I am thrilled to welcome Dr. Jenny Tufenkian. She's a naturopathic doctor, so bringing some views that are probably diverse from mine. She's been focused in this field for the last 20 years. And what I really love about her approach is she combines trying to heal the physical body, the mental and emotional body, and even the energy body. And I'm looking forward to hearing more about that. So before we dive into the topic, Dr. Jenny has kindly offered to talk about some of her foundational material, which is the 5 different types of fatigue that people with ME and other complex diseases get. What is at the root causes of each of those 5 types? And of course, most importantly for the listeners, how to heal from them. But before I ask her to dive into all that, I just like to, Jenny, welcome you to the podcast. Thank you so much for taking your time to share your wisdom and expertise with us.
Thank you so much for having me. It's just an absolute pleasure to be here with you, Eleanor. Thank you.
You're welcome. And I'd love to hear a little bit about your story. My experience is that people don't end up in this field by accident. And I have a little bit of behind the scenes knowledge. So I wonder if you could just share with the listeners how you got so interested in fatigue.
Absolutely. Well, it found me, as you know, from your own personal experience as
Yeah.
well. Yeah. So, I mean, looking back now, I think I probably had some version of myalgic encephalitis chronic fatigue from early on, even possibly as a child. And I think it was waxing and waning. It was probably a low-grade viral infection that came and went through my body as I look through it past. But what happened that was sort of the huge moment for me was I was a second year medical student and I had just passed my clinical boards with flying colors. I had decided to become a doctor when I was 6 months pregnant and single with my first child. And so I went through pre-med and early years of medical school with a small child. I figured I was definitely Wonder Woman and I could do whatever I needed to do. And I thought, hey, my first child's finally sleeping through the night. I've passed my clinical boards. Surely it's time. I had gotten back together with his dad. We got married. I'm like, surely it's time for us to have that second child. And I laugh now, but at the time it was challenging. I got pregnant and we had a miscarriage, grieved that, got pregnant
Mhm.
again. Everything looked great at 12, 13 weeks. And then at 17 weeks, I was like, something's not right. And sure enough, the baby was dying. And
Oh my
so I ended
goodness.
up having a second trimester, miscarriage. And And I hemorrhaged massively in my bathroom at 5 o'clock on a Friday night and ended up passing out in the bathroom. I had to be rushed to the hospital. And never was I so happy to be in an emergency room with all the lights and everything. And, had the emergency DNC, which saved my life. And that threw me into what I call a dark night of the soul. I had lost a lot of blood, so I kind of had a borderline something called Sheehan syndrome, where your thyroid gland gets a little bit messed up. And I ended up crashing and being in bed for months after that. I had severe depression. I was severe suicidal ideation. I was so exhausted. I couldn't, like, the energy of having my head on a pillow was a lot of energy. I had to lie flat on the bed. If I had enough energy, I used the pillow. I had to be walked to the bathroom. I could hardly eat. I couldn't sleep. Every time I closed my eyes, I saw these terrible, scary visions and I couldn't sleep. I had amazing team of doctors, my teachers, my colleagues were coming and being around my bedside, and I had IVs in my arm for nutrition, and people later confessed they were afraid I was going to die. I had ice up to my knees. It was really bad,
Oh,
and I was terrified every time my child and husband left the house. I thought they were going to die. It was just in this really horrendous state mentally and physically and emotionally. And it's one of those, when you talk about that physical, mental, emotional, and energy level, usually if you have like one thing happen, the others, this was all three systems were down. And in another time, I would have been called crazy and put into a padded cell because I was so non-functional at that time. Thankfully, times had changed and people saw that I was just going through something and I needed some love and support. I ended up having a number of therapists come to my room to try to help me. And one person that I ended up not using to work with, but she said, "You have to eat to live." And I remember that sinking in and holding the 7 almonds in my hand and knowing that was 14 grams of protein. And it took me about an
wow.
hour to get those down. And they're just like, it was so hard to eat. But that was when I decided I was going to live. And then the second therapist that we ended up working with was a hypnotherapist, and she did subconscious work with me. And that's when I really realized the power of that subconscious mind, which is
Mm,
95% of our minds. And there were stories that had been in there my whole childhood. There were events from my soul journey, from generational stuff, trauma that was in there that was impacting what was happening to me right there and then. And that got me out of the depression and the anxiety. It was incredible. We did a lot of different therapy, and um, I had a huge breakthrough moment with her where I went from not being able to handle any kind of visual stimulation, other people in the room, that kind of thing, to being able to actually function again. And that moved me from what I call the bed to the couch. So that's like 3 months of being in bed. Then I moved to the couch. I wasn't depressed. I didn't have severe anxiety, but I was left with this unbelievable fatigue. I had to take a whole year out of medical school. And at that time, I had another therapist who said to me, "Do you think you have chronic fatigue syndrome?" This was in the 90s. And I'm like, "Oh, get that label away from me. I do not have the yuppie flu." Oh, and then I was like, "Ugh, maybe that is what's going on with me." And so, sure enough, that was the diagnosis, was chronic fatigue syndrome. So I threw everything I had it as a as a student, and then as a resident, trying to fix this problem. And it became what I called a puzzle, and the different pieces of the puzzle. And this would help a bit, and this would help a bit, and this would help a bit. And what really was the breakthrough for the physical health for me was getting all 20 of my dental amalgams out and detoxing
mm,
from the mercury. And that from that I was able to then have full energy. And I went on to teach, and I opened clinics, and I had another child, and all these things happened, and I was just what I call full wave surfing, where I was on big waves doing lots of stuff, working those really long days without any crashes, and had lots of energy. Um, and I didn't think I'd ever get chronic fatigue again. And then I ended up crashing 17 years later when I was going through perimenopause, had a
wow.
knee injury, was changed my workout routine to for my knee, was doing a lot of upper body stuff, got frozen shoulder, and kept pushing through that, and ended up with severe pain where I couldn't sleep. And this time, what was different was that I mean, it was a couple things. I realized how quickly people can relapse, which I didn't realize before. Like once the pathway's there, it's very easy to relapse. So that's one of the things I talk about with my clients in
Mhm.
the first appointment is relapse, because what I want people to understand is when you uncover your root causes, remember that, because that may get reactivated in the future under a stressful condition. And if you know what got you out this time, that can be a toolkit you can pull in and use it before you go too far in. So I'm looking at this gaping hole going, oh my gosh, I'm going back in, but I didn't have the choice of lying in bed. For me to lie in bed this time would have meant bankruptcy for my family, literally. I had a clinic, I had overhead,
Wow.
my family was dependent on my income. I mean, that's what it would have meant. Because I couldn't sleep from the pain, I just got up and I researched everything, like what is the cause? Because the things that got me out last time, working on my adrenals, working on the heavy metals, that wasn't what was bugging me this time. It was something else, and I didn't know what it was. And the research then was still looking for the one thing, and I knew it was multifactorial. So I was digging in, as I'm sure you were at that time, trying to figure it out. And I have this thing in my clinic where if I'm too tired or my family needs me, my patients go away to give me space to do me. And I thought they would all disappear because I was so exhausted. And the opposite happened. They came in droves and they were all chronic fatigue people. No, I didn't do any marketing. They were just coming, they were just showing up. And I was booked out for months. And I began to understand these different patterns that I was beginning to see in people. And as I was doing research and I was trialing and erroring things on myself and my patients, it became clear to me of these 5 different core root causes. There are patterns that we see in people, and people may have one, two, three, or all 5 of them going on in their body. And they may be triggered by something on the mental, emotional, the physical, or that energetic kind of body. And it just depends, and it's different for each person. And so it's I've come to have this very individualized approach when I'm working with people. But when you ask, why do I do this now? Like I said, it found me. And then when the pandemic hit, I knew we were going to have a second pandemic of something called chronic fatigue, long COVID.
Yeah.
I didn't know it was going to be called long COVID because one of the root causes is a viral infection, the other is stress. And here we had both in spades. So, of course, it did happen, and I also got it. And so it's been
Mm.
kind of a further education for me to understand the similarities, the differences, and how this all works. And so it's been an ongoing journey. Yeah. And
Wow.
yeah, and I just one other thing I know about this journey that I think is so valuable has been valuable for me, and I share for those of you who are listening who feel the same, is that as challenging as it's been, and of course I'm upset with some of the life I didn't get to live and all of that, and yet I know that that time that I was in bed, it opened me up to a whole other level of myself that I didn't have time for as a medical student and a young mom. By getting what I call body slammed by the universe in that place, I looked at this kind of energy spiritual aspect of myself that I hadn't seen. And I know it allowed me to be a much better physician. When I went back to school and I was in clinic with patients, I was able to be there and hold them in a space that I hadn't been able to before because I had been
Right.
through a journey myself. Even though I didn't share my story with people that I was talking to, it was something that I learned deep inside my cells and in my soul and in my being that allowed me to be a better doctor. And I'm forever grateful for that. I don't wish it on anyone. It was a very hard time, but it has allowed me, there is wisdom that comes with that and allowed me to become more fully who I am. And I still believe that too with every challenge I've experienced in my life. It has allowed me to become fuller once I go through the hard knocks of it and come out the other side.
Yeah, wow, what a story, Jenny. That's really, thank you for sharing it. And I just want to say, like, I'm sorry for some of your losses. Those were pretty big. And like you say, now I guess when you're working with people, you really get it because you've been there multiple times in different ways.
Yeah.
Yeah. Maybe just, I'm so curious by the comment you made just before we dive into the 5 subtypes of some of the similarities and differences between ME and long COVID. Could you say a little bit about that?
Yeah, sure, absolutely. Yeah, I found it interesting because when I was looking at the pandemic and anticipating we would have this condition, and then people were getting this thing that we now call long COVID, I was really feeling like what I had learned from ME/CFS would apply, but of course I didn't know for sure because I hadn't worked with patients yet as it was just beginning. And I guess what I would say from having embodied both at the same time, I do feel like they're very the same. I mean, I do
Okay.
consider them to be the same thing. What I would say is that the COVID virus as an instigator of it for people, whether it's a reactivation of ME/CFS that you had before, or whether this is your first time of experiencing this kind of, deep fatigue, brain fog, or however it's manifesting in your body, the COVID virus itself as an instigator has its own unique signature. What I
Okay.
mean by that is that um, I see ME/CFS and long COVID. I see that they're conditions of dysregulation, and they're started in a body. One person is vulnerable to them based on what your setup is, what your genetics, what your lifestyle, the toxic levels in your body, your mental emotional state, all the things that we all talk about. What are your health foundations? How good or bad are they? Your sleep, your digestion, your detoxification, all that
Hmm.
stuff. That's part of your setup. That makes you more or less vulnerable to these conditions. And then there's an instigating event. There's something that happens, whether it's a trauma, a stress, a rough divorce, a car accident, an infection that triggers this thing for you to get into this dysregulated state called ME/CFS or long COVID. And what I would say is the COVID SARS-CoV-2 virus, if that's the initiating event for you, or one of your initiating events, because you can have more than one, then it has its own unique signature because it's a tricky little bug. Just like Lyme, I feel like
Right.
I feel like COVID is like Lyme. Like Lyme is a shapeshifter. It literally can be a spirochete, or it can be a wall of cell form, or it can be, it can be inside your biofilm. It can do all these different things. And it comes and goes. COVID, you feel like you're on it. You're doing so much better from your long COVID. You're like, great, I'm doing better. It's going away. And then the freaking thing takes a left turn and some other weird symptom shows up. That is COVID.
Right.
And I didn't
Right.
experience that with ME/CFS, whether it was, like reactivated Epstein-Barr virus doesn't do funky left turns. It's nasty.
Hmm.
It makes you exhausted and brain foggy, and you feel like you're walking through lead and cement all the time, but it doesn't do weird left turns. And I find that the COVID virus itself is unique in that sense. Again, more like Lyme and some other kind of trickier little bugs. So
Yeah.
that
And
feels really
even I'm just kind of thinking, you've made me think like so many people who say, I thought I was fine over COVID and then 2 months later got
exactly.
slammed with symptoms. So I think that's maybe what you're referring to.
Exactly, exactly. You get slammed on symptoms, or literally it goes to a different symptom in somebody with long
Yeah,
COVID.
crazy.
Like some of the brain fog lifts, but now you've got this weird nerve tingling pain or something like that. And so
Okay.
there's a lot of things and I think this is partly because of this virus has receptors. The ACE2 receptors are in so many tissues. I think that's one thing. So if you
Hmm.
have a reservoir, if part of your symptoms are due to a reservoir of the virus or viral particulate somewhere in a tissue, it could be activating multiple different kinds of tissues. Maybe for you, it's impacting your vascular system. So you've got some of the endothelial damage, or it's triggering that endothelial damage is triggering your immune system, and you've got mast cell activation syndrome. And so then you flare up when you eat a high histamine food, which seems random, but it is from the
Yeah,
COVID, right? It's like it can trigger so many different aspects of your
great.
brain.
Thank
So
you.
for some people, it's really impacted like for me, it really impacted my vagus nerve and my mitochondria. My mitochondria were trashed from this.
Wow.
Yeah.
And yet, as we're talking, you've got this really amazing energy. So that
Yeah,
to me speaks to the big toolkit that you have to help you and others recover. So I just want to dive into that and
totally.
ask you to describe the 5 different types of fatigue. I know, working for 35 years with people with fatigue, that to be true. Like, even though
Yeah,
everyone will say, I'm really tired or
yeah,
exhausted or
yeah,
but there's
yeah.
different types and nuances to the
Right,
fatigue. So
right,
I'm really curious what you're going to share
right.
about that.
Right. Yeah, you can probably appreciate this. I talk about my patients can talk about tired like wine connoisseurs talk
Right.
about fine wine. And I had one of my patients said, "Oh, sommelier of tired." I said, "Yes,
I
sommelier of
love it.
tired." Because there isn't just the one kind of tired. So I let me go through the five root causes
Mm-hmm.
and then I'll kind of talk about what they may feel like in a body. And
Okay.
so the first I call the gateway root cause, which
Mm-hmm.
is looking at that it's the hormonal system. It's looking at that triangle, that hormone triangle we talk about, which is the thyroid gland, the adrenals or HPA axis, and then your gonads, your ovaries or testes, depending if you're biologically male or female. And this triangle is wants to work as a symphony. They work really well when it's balanced. And if one of those systems gets out of balance, the others become out of balance as well. I call this the gateway root cause because we're so addicted to stress in this culture and we're living this 24/7. And a lot of people who are professionals and parents push themselves, myself included in that big time.
Yep.
And so it's very easy to get that hypothalamic pituitary axis adrenal thing dysregulated. And that can set you up for a whole host of problems in terms of blood sugar dysregulation, becoming more susceptible to infections and other root causes. So I call that the gateway root cause. The
Okay.
energy for that, how you feel there, kind of depends on which one of those systems is particularly out for you. It could show up as a kind of thyroid types of symptoms with very low energy all the time and hypothyroid, or it could be the hyperthyroid that's been masked, where you kind of have a autoimmune hyperthyroid thing that's impacting that. Your adrenals could be, you could be pushing so much cortisol that you feel tired and wired. That's a classic, right? You know that one well. It's
I
like
do.
people are just tired and wired. They feel like they have bad coffee in their system all the time but when it comes time to rest, it's hard to rest and it's hard to feel like you get that deep sleep. Or you could be flatlined cortisol where you just don't have any energy at all and you're exhausted, just dead all the time. It's just like flatlined, which I've also been, and it's not fun. So those are some of those energy patterns can kind of vary a lot, but I'd say the classic one for that one is that tired and wired feeling where
Okay.
you kind of I'm so productive in the morning. Oh my gosh, I get so much done. I get so much done, but it's a hollow energy. And then you just feel fried in the afternoon and you're kind of faking it a lot. And you may be addicted to sugar and coffee to keep yourself going. So that's kind of a good sign that that one might be going on. So that's the first
Mm-hmm.
one. The second one is looking at chronic infections. And
Mm.
these can be viral infections, they can be bacterial infections, they can be fungal infections, they can be any kind of infection. We have this whole biome that we share. There are more cells that aren't us than are us in our body. And we have a whole host of viruses that are living in us, and they can get reactivated. Many of these are opportunistic. And if we just talk about the viruses, there are some classic ones that we know, like Epstein-Barr virus, HHV6. A lot of these are in the herpes family, the cytomegalovirus. There's also parvo B virus. There are a lot of different viruses that can lie dormant and get reactivated under times of stress. And again, like I mentioned earlier, the motor vehicle accident, the challenging childbirth, the divorce, any of those kinds of stresses can reactivate it. And my experience with viral infections in particular, and these are some of the things I listen for, and I think if you have clinicians listening here, it's often stuff that people are too either dismiss or they're too afraid to tell somebody because they think they're going to think they're crazy. And that's some of the weird stuff are symptoms that come and go, like at certain times, I had
Mm.
one patient who had felt like she had the flu after orgasm. I would suspect that that was a viral infection that was kind of flaring after she had a big energy release. Things that impact the nerves, like tingling, I feel like there are things crawling on my skin, but I look and there's nothing there. Sharp wandering nerve pains. That can also be a Lyme
Mm.
infection, but it can be also be a different kind of viral infection because the viruses tend to like to get into the nerves. Sometimes the low-grade infections, women in our vaginal vault can hold low-grade infections that can really exhaust us. We can have low-grade infections in our mouth and our teeth and in our gums and in our sinuses that can impact and kind of wear down the immune system or make it hyperreactive. And if you have one of those low-grade infections, it's sort of this, I find that people often feel it's like this heavy tiredness most of the time, if not all the time. It's kind of like you're like dragging, like walking through molasses. Like I remember patients say, it was like I'm walking across the parking lot and it's like I'm walking through molasses, that heavy, heavy feeling in your
Yep.
body. and heavy in the limbs, like the legs feeling really heavy, like that's a classic sign of, for a lot of patients, of the Epstein-Barr virus or one of the viruses.
So, Dr. Jenny, would you say if people feel flu-like, they have maybe the swollen lymph glands, they're achy, the low-grade fever, that would go with this category?
100%. Yes,
Okay.
definitely. Those swollen glands that come and go. I
Yeah.
wake up every morning with that little sore throat.
Oh,
I
yes.
always, and also, and a lot of these people either never get sick because their immune system is so suppressed it's hardly reacting, or they catch every single thing that comes through the room.
Yeah.
You know, that like kids come over for just a couple hours, they walk through the grocery store or whatever, they catch everything all the time. So it's either one of those two pictures. But yes,
Okay.
those are classic
Great.
signs.
What's your next one?
So the third one is looking at toxins. And
Ah,
this is looking at toxins that are in and around us all the time. It's just the world that we live in, and sometimes that can be due to too much exposure to toxins and or not having your ability to detoxify. Your what we call emunctories, your pathways to elimination are blocked, or your liver and gallbladder are blocked up, or your digestive system isn't working correctly. So the
mhm,
toxins, so it could be heavy metals, it can be glyphosates, it can be other, plastics, it can be all kinds of things. And the toxins are, classic sign for toxins for me, or something to do with the detoxification system, are headaches. If
oh,
people are getting
interesting.
headaches, then that's a real sign to me that there's something going on with the liver. And I look at some of the toxic things. The
Okay.
other signs with and I'm going to jump to the next root cause because they're so interrelated. The next one is looking at mitochondrial function. And
Hmm.
the mitochondria are the powerhouses of all of our cells. It's where our energy is formulated. Those mitochondria are so important that if they were all to die, you would live 3 seconds. So they're so essential to life that we have to have them to live. And they're amazing, but they're also extremely vulnerable to all kinds of insults in the body. And there are some toxins that land inside these mitochondria, in particular, things like mercury and lead, those double charged metals get sucked
Hmm.
right into the inner membrane of the mitochondria and block the mitochondria from doing its own glutathione detox production within its own cell. And that limits, and that makes the mitochondria itself more toxic. So then it gets destroyed by the body instead of surviving. So there's a lot of overlay between these different root causes and the mitochondrial function. And viruses can go into the mitochondria and actually literally change how your energy production is made. So the viruses, you may have a chronic virus that goes in and turns your ATP system to start feeding the virus. So you have less sugar and energy for your body because it's going to the virus. And these are
Wow.
literally things that happen inside the cells. People ask me, well, why don't you just say why do you put mitochondria there as one of the root causes instead of like the thing? And I think it's a fair
Right.
question. The reason I've done this is because clinically, even though like I can intellectually say it's all mitochondria, what I've noticed clinically is not everyone presents with mitochondrial fatigue. I would say that most of my long COVID patients do. I think that the mitochondria is more particularly damaged in that, but not all of my ME/CFS without long COVID patients have mitochondrial damage. Mitochondria is, if you have post-exertional malaise, you have something
Mm,
going on with your mitochondria.
okay.
So if you do more activity than you usually do and you're more tired, whether it's for the afternoon or the next 10 days or 2 weeks, that's post-exertional malaise. Like for some people, it's you did the dishes and the laundry. For somebody else, it's
Right.
I did a 5 mile hike instead of a 2 mile walk. Then that's post-exertional malaise. That means your mitochondria can't reset their energy quick enough for you, and it takes more time for them to heal. That means there's something going on with the mitochondria. And what I usually do with those people is I have them, I do a challenge. I call it a mito challenge. And I give people mito food, which is I give them the D-ribose and some antioxidants like resveratrol and lipoic acid, some CoQ10, and I just have them do high doses of those for 5 days and see if it makes a difference. If it makes a difference, then that becomes a bridge for them to have more energy to work on their other root causes.
Hmm.
And if it doesn't work, then it is really helpful for us to know that something is blocking their mitochondria from functioning well, which then my next place that I'm going to go, because it's so common, is I'm going to run a heavy metal test on them to see if they have heavy metals,
Hmm.
because that's going to be the most likely thing that I see. And then often I see if we clean up those metals, if that is indeed it, then we can give them that mitochondrial food again. And their body goes, oh, thank you. Now it gets in and it works. And now I have the bridge. So that's just kind of, that's a very clinical
Hmm.
example that I think you can appreciate from being a clinician for 35 years, that I want stuff that works for people like in front of me. And we
Yeah.
can start ruling in and ruling things out, because it's a complex condition and there's a lot to look at for each individual person.
And I love the tool, like the clinical tool of post-exertional malaise. I know people who have it don't necessarily love it, but it
Yeah.
doesn't cost any money. You know, a lot of times we go to a functional medicine physician, naturopathic doctor, integrative practitioner, and there's so many tests. They can
Yeah.
cost
Yeah.
thousands and thousands of dollars, right? So to
Yes.
have some,
Yeah.
like some of the kind of uh, nuances that you're sharing, well, this fatigue feels a little bit like this, and that would
Yeah.
just at least alert you maybe to look in that direction instead of doing
Exactly.
everything. So
Exactly.
many practitioners are not indiscriminate, right? And they just say, oh, I want you to do my whole panel. And it's
Exactly.
like, well, a lot of people just can't afford it.
Yeah, exactly. Yeah. And so this is what I'm doing in my mind when somebody comes and sits down with me, is I'm listening to their history and their story and what they're and how they're talking about what their body is. And I'm kind of going through my head, and it's like I'm putting little beads inside of the containers of the root causes. What do I think? What do I think
Hmm.
is, if they tell me I had mono when I was in high school, then I'm going to be like, well, like, I then that's going to put a little bit more on the virus weight, right? Weight,
Yeah.
right? That's one bead into the post the viral condition. Anyway, so the
The
mitochondria.
last one. Yeah.
Last one is looking at that emotional limbic brain system.
Ah,
Yeah.
okay.
Yeah. And so this was huge for me when I discovered that this was a thing, many, many moons ago now. And this was when it was first kind of coming out. This came out of the understanding of some of the studies around epilepsy and how the brain works, and around neuroplasticity, and realizing that the brain gets stuck in these loops, these feedback loops.
Yeah.
And it's all set up for safety. So you have this limbic brain that's in the above your brainstem, and it's always surveying for safety and danger. And we have different levels of filters for safety and danger based on our childhood experiences, our in utero experiences, our generational experiences. All these things lay our filters as to whether we see the world as being more safe or more dangerous.
Hmm.
And when we get sick, of course, we feel like the world is more dangerous. It's a form of protection. And what can happen is your limbic brain can literally become dysfunctional, or now they really think it's more the amygdala and the insula. The amygdala is part of the limbic brain, and the insula is technically not part of the limbic brain, but I still call it all the same thing. But that system literally will, in its desire to protect you, when you are experiencing some kind of illness, it will amplify the signals to your body to make you feel more tired, more pain, and more in pain, and to have you isolate and stay away. And basically, it's saying, I don't know what's going on up there, but it is not safe. And I need you to go back and hide in your cave. So I'm going to send you all
Yeah.
these signals. And it does this through the vagus nerve. The vagus nerve is the wandering nerve that attaches to that part of the brain, goes to every organ in the body. And that vagus nerve sends impulses that literally goes all the way to your mitochondria. So talk about connections between these root causes. That limbic brain can send a signal to the mitochondria to put your mitochondria in a dormant state, a hibernation state called torpor syndrome or sickness syndrome, and they basically slow down. And this becomes, and then you get into this vicious feedback cycle of your mitochondria not working as well, sending messages back up through the vagus nerve, and you get into this vicious cycle where the body can stay sick. And it can be through this limbic,
Even though the danger has passed, right? This
even
is
though
what
the
I
dangerous path.
emphasize, and through no fault of your own.
And no
Because,
fault of your own. You're not
yeah,
making it up. Just because it's part of
yeah.
your brain doesn't mean you made it up. It's not your fault. This is not a psychosomatic illness. That's not what we're talking about. This is pure physiology. This is pure physiology. It's there to help you survive. And it's just important for us to understand it so that we can use, when you talk about your mind as a pie, shape of a pie, 5% is conscious thought. We need to activate that 5% of conscious thought and go, oh, hello, limbic brain. Thank you so much. I love you too. Thank you for protecting me. It's okay. There's an adult in the room, because really that limbic brain is about 3 years old. Say there's an adult in the room. You're safe. You can come out. Let's go look at some butterflies.
Yeah.
Like.
I really love that explanation, Jenny, because you're kind of explaining the mind-body connection. And as I'm sure you know, that's such a contentious topic in the field, right?
Yeah,
There's
yeah,
people who kind of feel everything is emotional, and there's people who think everything is biomedical.
yeah,
And I'm confident, and it sounds like, we're on the same page here, that the mind and the body, and maybe even the bigger energy environment are all connected. And
100%.
like, I think it's good because it means we have more tools at our disposal.
Yeah, right. Exactly. Exactly.
Hmm.
And yeah, and that's why, I think it's important for us to see that we're a physical and mental, emotional, and energetic body, and they're all connected. It's not like they're disconnected things. They're all interconnected and they influence each other. So, an example of that energy body is a lot of us are empathic and pick up things from our outside field. Some of you maybe feel
Hmm.
sensitive to electronic medical, EMFs, or from you walk into a room and somebody's really angry or scared, and then all of a sudden your belly doesn't feel so good. And that can be, you're picking up you're literally picking up their energy and becoming aware of that energy body of yours. You can begin to have practices where you can learn to clear. So you're not attached to other people's energy. You can learn how to fill up your energy with what it is that you want to fill it with. You can get to put tools in your toolkit that know things that you can do to help you feel better. So it frees up the flow, because you like you walk in a room and somebody's angry, that hits your stomach, and then it triggers the memory of somebody being mad at you when you were a kid, and then that triggers that, and you've got this physical response in your
Yeah.
tummy, and then that sends off, inflammation signals that can trigger all the way up to your limbic brain. So you can see how that stuff can begin to really impact your health.
Wow. Thank you so much. That is a great, I called it an algorithm when we were talking before, right? But
Yeah.
can
Yeah.
you kind of now go through each of those five and what's your approach? Maybe both in terms of testing, because I'm guessing when we're talking hormones and things, some tests might be involved, but also maybe things people can do who maybe don't have financial resources to kind of mm, try something and it would help
Sure.
kind of convince them, yes, this is what's going on, or nope, that I'm going down the wrong path and maybe
Sure.
shift to a different idea.
Sure, I'll be happy to do that. And I just have to be honest, like, I mean, I literally have taught this and in courses, and it takes
Yes,
days
of course.
to get all of this through. So, and I want to give some value to those for you who are listening to this. So if we go back to that first root cause, that hormone
In
triangle.
like, sorry, in like 15 minutes. So we're not
Yeah, yeah,
talking the master's level
yeah,
course
yeah,
here.
yeah, yeah,
Yeah.
yeah, yeah, yeah. So that first root cause, that hormone triangle, definitely. I'm a big fan of 4-point cortisol testing for the
Hmm.
saliva, doing a saliva test, a 4-point cortisol testing. This is now Quest Labs now does this. It's kind of a pain,
Oh.
but they will do it, and most insurance will cover it. So you can get that done. I think it's the best way to assess your cortisol levels. I would also look at the DHEAS hormone as well. And I would do blood and salivary if I could. And what I'm looking for is a nice high point in the morning with a nice even slope within the normal levels. And you just want to be sure you have that nice high. You need the immune wash. You need it to come down through the day and be low at nighttime so you can get to sleep, and it should rise while you're sleeping. So that's what we're aiming for.
Hmm.
If that is off balance, it totally depends on whether it's too high or too low as to what I do. But I love adaptogens, which are botanicals, which will adapt to you. If your cortisol levels are too high, it will bring them down to normal. If they're too low, it'll bring them up. And those are great. I think that Serifos is great. Phosphatidylserine is great
Hmm.
for people who have abnormally high cortisol levels. It brings it down into normal. Taking that an hour or two before your high levels are great. I do, for those who are okay with clean animal products, I do like taking protomorphogens for people who are flatlined or really exhausted. And for some people, I will use a physiological dose of cortisol. So the big anti-inflammatory drugs that we use, those are very high levels. I'm talking literally the level that your body would normally make of Cortef or cortisol levels, and I'll have those compounded and do those throughout the day for a short period of time to give that adrenal gland a break. And I can tell you it's incredible. I've only had to do it literally in a handful of patients over 25 years, but for those it does, it's amazing. I've had to take it myself, and it's really helpful. So
Yeah.
thyroid stuff, I do a big thyroid panel. I'm looking at free T3, free T4, TSH, TSI. I'm looking for autoantibodies and, really what's happening to your actual hormone levels. Straight TSH, I do not find that helpful. And I really would argue hard and fast to your physicians to give you a full panel for your thyroid because that's essential.
Okay,
And
thank you.
yeah, and some people, and I order a lot more TSIs, which is looking to see if you have hyperthyroid or Graves' disease now than I used to, because it can get hidden. And some people can have both. You can have hypo and hyperthyroid at the same time. And so I think it's important to look for both of those antibodies for any of the clinicians or for those of you professional patients that are wondering, because that can happen. And
Wow.
then for in terms of hormone testing, I'm really more looking at history there. I I will do serum testing for hormones in some situations, but I find that the ranges are so wide, it's only helpful. I'll do it as a screen in some cases. The one thing that I may look for more often than not is pregnenolone. That's a blood test that I pull quite a bit because it's the parent hormone. All of our hormones
Right.
come from a parent hormone, and I look at pregnenolone levels. Some people are just exhausted because they don't friggin' have enough pregnenolone. If you give the body pregnenolone, the body knows what to do with it, and people feel amazing. And that can be especially great for perimenopausal women who are starting to go through early perimenopause. That pregnenolone can just be a nice boost, and then your body can balance it out. You don't have to be doing a little estrogen, a little progesterone, all that. Your body can just get its mama hormone and get
Yeah.
balanced. So
I
those are
love
the
that,
things.
letting the body's wisdom kind of do the
Yeah,
work for
right.
us.
Yeah,
Yeah.
yeah, yeah. And I would say as what I think is great about looking at this hormone triangle, and I think is a real important clinical pearl that people like to hear, is that if you're treating the HPA adrenal axis, that you should feel better within 2 weeks of starting any protocol for that. I expect people to feel better. I don't expect them to be healed. I don't expect them to be 100% better. They're totally not out of the woods yet, but I expect them to go, oh yeah, I did feel like I had more energy. I didn't have to take the nap after lunch, or I was able to do the dishes and the laundry, or whatever it is. It's like
Hmm.
it's 1 or 2 points of energy up from that. If that's not the case, then that protocol needs to be reworked. And that's, I think, one of the important things that I know that when I'm working with my patients is that I'm always listening for what's working and what's not working, because that's part of the feedback that we're trying to figure out what works for you as an individual person. What works for
Right.
Sally is not the same thing that works for Sam. And just because your best friend was really successful in this protocol doesn't mean you will be. We need to individualize it for you. So, and also means don't give up because something doesn't work, and don't go back to your doctor. Just say, hey, this didn't work. What else you got? What can we tweak? I see people dropping the ball too many times because something didn't work the first time through the gate. Okay,
I like that message,
off the
like
soapbox now.
persist. Yeah, but persist and tweak and titrate and give it a
Totally.
really good try before you abandon it.
Totally, right.
Yeah.
Yeah. Which is why I think the individualized approach is the only way we can work with these complex conditions, because you are so unique in terms of which root causes and which health foundations need to be addressed for you. Okay, so second one, viruses. So this is a lot on history in terms of what I'm hearing you say, in terms of your patterns of illness through childhood, adulthood, depending on how old you are, and how you're explaining your fatigue. We don't have any great tests for viral reactivation. We don't even have names for all the viruses that may be in your body. We don't have tests for most of them. Those that we have tests for, great tests for, are none. The best test we have for reactivation is Epstein-Barr virus. All the others are, we make some rough calculations to say, yes, this is reactivated or not. And then we need to treat to see if you get better. And so that's kind of the process. And I do run a large viral panel on the patients that I can.
Okay.
And what I'm looking for is I'm running what I can because I want to see what flares up. It's going to give me a clue as to where to go because I do individualize the viral treatments if I know they have that virus. I treat chronic viruses as a three-legged stool. I do some kind of antiviral, be it nutraceutical or pharmaceutical. I do a combination of botanicals and I do homeopathic no-sodes. And I
Hmm.
found that to be an incredibly powerful triad that I have seen work over and over and over again. And I'm so grateful to have that and very happy to share it because it's so powerful. And I think more people need to have it. And I think we'd have a lot less long COVID if if all the doctors out there who saw every long COVID patient knew to test their patients for reactivated chronic viruses, and treated them, you would take care of a big swath of the long COVID people. I don't think everybody has this, but a huge hunk of them do.
Wow,
Um,
interesting. Thank you.
yeah, and then other infections, it just depends on where they
Yeah.
are and what we're doing, but there's the individualized treatments. But there's some really powerful, as a naturopathic physician being trained in botanical medicine, I am a huge fan of the botanicals for these. The
Hmm.
only people that the botanicals may not work as well for are some of the really activated mast cell activation patients. Sometimes they do
Right.
actually better with pharmaceuticals, I'm finding.
Interesting.
Yeah, so next is looking at toxins. So toxin panels, I feel like we all have toxins in us. And so
Right.
I know I could run toxin panels on everybody, but sort of to your point of it's easy to get out there with all these functional medicine tests and run a bunch of tests. I'll run toxin panels on people that I think it's really important to run them on. But I'm more likely, the heavy metal testing I find to be quite helpful, and I actually do a urine panel for that. There are some tests that I do run for toxins where I'm looking at what is your immune system reacting to. And one of the big toxins is mycotoxins that I didn't mention before. So
Hmm.
I do mycotoxin testing, and I prefer the blood tests looking at the what your immune system is reacting to over the urine test. I have used the urine test in the past. I mean, we could have a bigger conversation, but
Hmm.
that's kind of where I go there. And then in terms of how do I work on patients, again, it depends a lot on what comes up with them, but basic treatment guidelines, opening up emunctories, getting your body to detoxify, saunas, water, looking at liver function, gallbladder function, are you having regular bowel movements, all the basic stuff that
Yeah.
you think about to open things up. And then there's just a huge toolkit in terms of botanicals and things that we can work on to support those systems and to get those elements out. In terms of heavy metal detoxification, I think there's three levels that are optional to people. There's the chelation, IV chelation, which I refer out if people want to do that. There's oral chelation, which I do with some patients in a very special way. And then there is just really natural, very just homeopath doing drainage, doing consistent, kind of
Hmm.
regular, simple thing for my more sensitive patients. And that's very independent on how sensitive they are. And then on the mitochondrial function piece, like I mentioned, I have the challenge that I give people. So if that works, those products that I mentioned before, then that's great. That's their protocol while we're working on the other root causes. And I may bring in a few other things to support the mitochondria. If that doesn't work, then like I said, I'm bumping up to the toxins to see if we need to do some detox to get that working. There are some people with COVID who have, it seems to me that some of the long COVID people, it's activating some kind of an autoimmune type thing in the mitochondria. And for some people with long COVID, it also seems to be altering your fat metabolism. And for those people, we may need to do some extra special tricks to try to to work on getting the body normalized again. And so it can be
Okay.
a little bit more complex for some of those folks, but that's there. I think sometimes a ketogenic diet is great for some people, and yet some people are keto resistant. And so we need to work with them individualized there. All the stuff you talk about hormesis, and you're the expert in the hormesis stuff,
Mm.
of course, is great for the mitochondria, the hot
Right.
and cold, the red light, the um, all of those things are so essential for mitochondrial function. So that's part of the mitochondrial care as for it's really helps all of it, right? That helps
Yeah.
every single one of the systems, which is I'm sure why you talk about it, because it's kind of one of those, wow, if we all did this lifestyle, this hormesis lifestyle, the body could then get regulated in a much better way. Limbic dysfunction. So what I want to say about limbic dysfunction that I didn't mention before, it's like, what does that person say that keys me into it being limbic dysfunction versus
Yeah.
something else. And so, a couple things. Multiple chemical sensitivity is limbic dysfunction. And for some of you listening to this, you're like, no, that's not it's just toxin and the world's killing me and it has nothing to do with my brain. It's like, I get you. I counted myself as a canary in the coal mine. I didn't understand why the world was so toxic. And every time I went to a bathroom and put that soap on my hands, I was like, oh my God, I'm going to hold my breath. And then I did my limbic retraining, and literally I'm in the bathroom and I'm like, oh, that smells kind of like the perfume grandma gave me when I was 8 years old. That's so sweet. Oh my gosh. And I was like, what just happened? Like it smells sweet to me. It smelled like apples or something. I don't know. And literally your brain changes. And now I can tell when my limbic brain is activated, it's how I smell the perfume coming off somebody's body. And
Interesting.
I never could walk in a perfume store. And now I have no problem walking through that section of department store. It's amazing.
And it's so fast, right? I mean, my experience is very similar to yours.
Yeah.
And I
Yeah.
had very, definite ideas that this was a biomedical problem.
That's
My
right.
genes haven't changed. I got all the bad genes. They're still there.
Right.
And you're right. Now I smell something and go, oh, I get why people like
Yeah.
perfume now. It's
I know
actually
that's why they
really
douse themselves
pleasant.
in that stuff. It's kind of like, oh, okay. Like I would
Yeah.
live with it, but okay. I can appreciate it while I'm in the elevator with you, you know?
Yeah. So
So,
that's great. Boy, you've given us a lot.
yeah, so that's one of the huge tips. And then I would say the other thing is the conversation is it's the sense of dominant fear or this
Hmm.
worry that the other shoe's going to drop. I got a little bit better, but now I'm worried that this is going to happen. And I
Yeah.
know a lot of us have that. I mean, a lot of us do, and it's really easy to get into that thinking with fatigue because you're always energy budgeting. You never know if I overdo this, if I go out with my friend tonight, how's it going to be tomorrow for me? And so there's this kind of this thing that gets set up subconsciously and it can trigger that fear response. But living in that fear all the time is a dysregulated amygdala insula limbic brain piece. And that's part of what I'm listening for in people is
Hmm.
is that and yeah. So,
And I guess in those people, you would be recommending some kind of neuroplastic intervention,
right, yeah,
brain
exactly. And
retraining.
I
Yeah.
think there's so many out there. I think there's some really great brain retraining programs. I think it depends on what resonates with you in terms of their style and their personality. I think Annie's is more what's it called? I'm thinking on the name of it. Anyway,
It's the dynamic neural retraining
yeah, it's
system.
dynamic
Yeah.
real train system, but hers is more based on NLP. That was the word I was looking for.
Oh, okay.
Whereas Gupta's is more based on somatic. And I think they both have different personalities. I think they're both great
Hmm.
programs. And there are a lot of other programs out there as well. Literally anything that's going to get in there and access that subconscious mind and
Yeah.
allow your nervous system to realize that you're safe is going to work. Some people just doing somatic therapy is what they need, or, EMDR to release some of the subconscious trauma patterns. It
Yeah.
depends on what you need. But I would say, keep going on that work until you get resolution because it is pure magic when you shift to the other side. You will not believe how different you can be.
That's fantastic. That you've just given us, I mean, a wealth of information and tips. So I really, really appreciate this.
Sure.
I just wonder, is there anything else maybe that you forgot to mention that you just don't want to leave without adding?
I feel like that's
Pretty
complete. The only
complete.
thing, yeah, I feel like the only thing I would say is that I would just say don't give up. I mean,
Right.
I understand, if you're dealing with this, it's challenging, it's hard. You have days where you're just hitting your head against the wall, and I get it. When I got reactive with COVID, I look over here because it was like that hallway that I can see over here, you can't see. That I
Yeah.
remember literally walking out and putting my head against the wall and sobbing. Like, and that was me
Yeah.
as a doctor, having had this, having come through it, having created programs for physicians to teach them how to treat it. And yet that was my personal experience. So I get it. We all have those moments in those days. But what it is that you do after you have that sob moment and, pick yourself back up and choose, okay, so what's next? Like, what's the
Yeah.
next thing that I'm going to do? Who's the next person I'm going to talk to? What's the next book I'm going to read? Like, there's something, I just know there's something out there for you to allow your body to heal. And I think both Eleanor and I are examples of that. I mean, we have been in both in places where we've had this and not. I'm still coming out of my long COVID. I'm way, way, way better than I was. I'm super high functioning. I know a lot of people would like to be where I am, yet I'm going for the place where I have no limits. That's my goal.
Exactly.
I've been there before and I'm going there again. And I know I am. I just and I figure that everything I'm learning while I go is what I'm learning. So yeah, so no, I just say keep going and know that there is a way for you to heal.
Thank you so much. How can people find out more about you? I don't know, do you do like one-on-one in-person work or how do you practice?
Yeah, so I practice in a multitude of ways right now. So right now
Hmm.
I bring a few people on for one-on-one work. I bring them on for what I call intensives, where we work together and we commit to work together, usually for a year, because I usually
Okay.
take that's what it takes. And I just take on a few people so that I have time to bring them in for as much as time as we need to work together to work through these pieces.
Hmm.
I also have a group program that's amazing, and it's filled with these incredible people who are and we go through and we meet. There's a meeting 4 times a month. Two of them were with me, one with a nutritionist, one with a somatic therapist. And that also includes an online program that I've created. So we use that as a guide, and that's incredible. That's a great way to kind of have your journey be supported as you're going through these different pieces. And the people that come in the group program usually have access to do a few one-offs with me at a discounted rate. And then I have a DIY, do it yourself programs as well that people can check out. I have a level for practitioners and I have a level for clients. And I have a lot of content online as well that you're welcome to check
Yeah,
out free.
a lot of great content.
And something you mentioned before is I do have a quiz that I have
Hmm.
set up, and it's literally, I set it up as following the algorithm that I laid out of these 5 root causes. I literally did the quiz thinking, how would I think if somebody sat in front of me and I'm trying to rule in or rule out these different root causes? And that's how I created the quiz. So I recommend you take that. Of course, it's not diagnostic. It gives you an idea of where to start, but I recommend you check that out. And it's on my website, which is drjennytufenkian.com. That's drjenny, Jenny, Tufenkian, T as in Tom, U, F as in Frank, E, N as in Nancy, Kian.com.
And of course, we'll have all those links in the show notes. Thank you so much. This was really valuable, and I'm very confident that the people listening are going to really get some direction from what you've shared.
That's wonderful. Thank you so much for your work, Dr. Eleanor Stein. It's a pleasure to be here with you. Thank you.
Thanks for joining me on the Dr. Eleanor Stein podcast. I hope you are taking away new strategies and ideas to improve your health and a renewed sense of hope. Join me, Dr. Eleanor Stein, for our next episode. Can't wait? Check out my website for a wealth of free resources.